Hi there, my name is Sarah Lewis. I will be presenting today on Chapter 1, The Science of Psychology. This chapter introduces many principles of psychology that will get covered in later chapters, so for this video we will be discussing the following three topics: careers in psychology, the scientific method, and ethics in scientific research. Okay, careers in psychology. In the most general of senses, a psychologist is a professional who is interested in human behavior. Psychology seeks to understand how things like cognition, emotions, and environment influence the human mind and affect how we behave. Work can include things like conducting research, providing treatment, and offering expertise in a variety of consultative roles. Most psychologists have at least a graduate degree and many a doctoral degree, depending on their work and focus. Here are some areas of specialization: therapy, health, sport, forensic, industrial, organizational, and research, things like experimental, cognitive, developmental, social, etc. In our day-to-day life, we generally encounter psychology through therapists. These therapists come with a range of titles like licensed marriage and family therapist, LMFT, licensed clinical social worker, LCSW, PhD, PsyD, or MD. Each of these titles features training from a specific psychosocial perspective, and these therapists provide treatment for varying degrees of mental health. Supposedly, certain practitioners, MDs, PhDs, and PsyDs have specialized training to diagnose and treat more serious mental health conditions. However, there appears to be a great deal of crossover between all types of therapists in what and how they treat. Here's a clip of Dr. Ramani, a psychologist at Cal State LA, talking a little bit about why talk therapy is so important.
When talk therapy is occurring, what's happening?
It's a great question. When talk therapy is occurring, lots of things are happening, interestingly, at the same time. At the most basic, someone's talking and someone's listening. But that person who's listening is also paying attention. They're listening for themes. They're asking questions. They're giving reflective statements. Therapy, though, is not as often about advice. Therapists won't say, I think you need to pack up your house, move to New York, break up with your boyfriend, and get a new cat. Like, that's not what's going to happen in therapy. What's going to happen in therapy is they're going to listen to you. They're going to help you see patterns. But by the time it's done, if that therapist has done their job well, you'll be able to find those patterns on your own when you finally do leave therapy.
People who work as LMFTs, LCSWs, and counselors generally have license-specific master's degrees and complete specific state licensing requirements. Oftentimes, these professionals approach therapy from perspectives relating to society and family structures, so they are especially good resources to help individuals or couples work through life stressors. Clinical psychologists generally have a doctorate in the form of a PhD or a PsyD. Appropriate for people who want to study, understand, and treat mental illness, these two rigorous degrees emphasize research and clinical practice respectively. Neither of these professionals can prescribe medication. Lastly, we have psychiatrists. These are your medical doctors, your MDs, who treat mental health issues. These are the people who can prescribe medications. Though they learn aspects of psychotherapy, today most of these specialists focus primarily on medication management. Psychiatrists do quite well, so if you're interested in earning a lot of money and don't mind 4 years of med school and a 4-year residency, you could consider that. Also, you might be doing a good thing because there is a shortage in this field, so it can be hard to find the right doctor. Now let's talk about the scientific method. If you can recall from junior high, the scientific method is designed to protect and maintain the rigor of science. It is a standardized way of conducting research designed to minimize human error and bias and maintain a baseline level of quality. The scientific method starts by making observations. My daughter is 2 years old, and I have observed that when she gets active and silly, she likes to playfully bite me. So maybe I want to know if this is normal. I do my research and I see that yes, toddlers bite for a variety of reasons, but I still want to know how normal it is for 2-year-olds to bite their parents. Now I have to formulate a hypothesis or a testable question. For example, maybe my question is, how frequently do 2- and 3-year-olds bite their parents while playing? I hypothesize then that a 2-year-old is more likely to bite their parent than a 3-year-old. Now I design an experiment, and in my experiment, I decide I'd like to observe children playing with their parents in a lab that has been turned into an age-appropriate playroom. Perhaps in a 30-minute window of time, I will count the number of bites. I won't tell my participants what I'm looking for, but obviously my observers will have to know. In other words, this will not be a double-blind experiment. My experiment should give me data that, when analyzed, might tell me that my sample Of my sample, 18% of the 2-year-olds bit their parents, while only 5% of the 3-year-olds bit their parents. Then I conclude that a 2-year-old is more likely to bite in playful situations than a 3-year-old. But there can be more. Maybe my data leads me to other questions. Maybe now I want to see what other behaviors correlate with toddler biting. Then I would formulate another hypothesis and construct another experiment to test it. So the process of scientific evaluation by means of the scientific method is a tool we can use to find answers to questions we may not otherwise know to ask. Okay, a quick note on definitions. The words hypothesis and theory are often used in colloquial speech incorrectly. A hypothesis is a testable prediction. A theory, however, is an explanation of an observation or question that has been repeatedly validated by the scientific method. Theories are not static. They can change as we learn more and as we accumulate more data. Similarly, no theory is ever proven true. It is only ever disproven. So if people say it's proven, they're just wrong. Additionally, we have things called laws. A law is something that predicts what will happen without attempting to describe why it happens. Evolution, for example, is a law. Quantum mechanics is a theory. In fact, it's one of society's most validated theories. And the statement, "People will like me if I dye my hair pink," is merely a hypothesis. Understanding the correct usage of these terms will help us better read science presented to us, which is important these days. Research can be conducted in a few ways. What we previously described is an example of an experiment. In this experiment, we used laboratory observations to collect data on a sample of individuals. The downside of laboratory observations is that they are not always an accurate descriptor of behavior because a change in the setting could mean a change in the behavior. A generally more accurate picture is created by using naturalistic observation. This means observing the subject in its natural habitat and seeing how it behaves. For example, please observe this toddler in her natural and messy environment. Admittedly, there is some amount of observer bias here. Though she doesn't know I'm watching her exactly in this moment, she does know that I'm home. As a parent, it is fun to watch your child play without you, and it helps you understand how they are developing. And if you have any additional questions, you could design another experiment based on what you see the child doing. Okay, so other methods of study involve case studies, which is an in-depth look into a single individual, and surveys, where you take a random but representative sample, you hand out a list of questions, and let them answer. Both of these methods help you understand human behavior, but they also each come with their own inherent biases. So here's an example of a survey. And in an effort to reinforce what a theory is, I'm going to survey college students to find out how many of them know what a theory is. So the question maybe is, what percentage of college students can identify major theories when presented with a list of scientific concepts? I randomly select a good representative sample of participants and survey them. Okay, is the following a theory? String theory, yes or no? Classical conditioning, yes or no? Quantum mechanics, yes or no? Laws of thermodynamics, yes or no? Okay, so in case you're curious, of the terms listed, only classical conditioning and quantum mechanics are scientific theories. String theory, though it's called a theory, isn't even testable, so it's barely, arguably, a hypothesis. And the laws of thermodynamics are just that, laws. So I have my survey data, and I compile it. So it's really important that you define the concepts that you are studying, and you set rubrics before you can make comparisons and draw conclusions. Once you do that, you can also find correlation coefficients to draw relationships between the things you're studying, the variables. Perhaps, maybe in this example, I can predict how a person answers one of my questions based on their response to another one. Perhaps. You'd have to look at data and decide if that relationship exists. Lastly, we will talk about ethics in the scientific method. Scientists seek to maintain a baseline level of ethics in all research. Oftentimes, ethics committees are used to look over proposed studies and judge them for safety. These committees are made up of field professionals, and they give the go-ahead to proceed with research studies. Okay, so here are a list of common ethical guidelines, and basically, to sum it up, the participants are free, they're informed, they are protected from risk, their data is confidential, They're made aware of what the study was testing and the results of it at the end, and the researchers are accountable to the participants if there are any negative consequences. They're responsible for either correcting those consequences or removing them. So obviously not one of those things was ethical, and this is why we rely on case studies, surveys, and the meta-analysis of data. We also use various statistical methods to find relationships. We generally can't prove causation with a lot of these methods, but it shows us what to study and where to look. So thanks for spending this time with me. In summary, we discussed psychology as a career path and a science in terms of psychology therapists, the scientific method, and ethics in research.